naturopathic medicine or kind of had some exposure to some degree? Has anyone never heard of naturopathic medicine? I hope that some of us have. All right, so I mean, I'm just going to talk a little bit briefly about what it is, how it fits into kind of Canadian model of healthcare, and then kind of where I practice and how I kind of approach health here. So a big question that naturopathic doctors quite often ask, and really an integrative doctor will ask, is what's the difference between unhealthy and being sick? So a lot of people will think, okay, if I'm sick, then I'm sick, but if I'm living an unhealthy lifestyle, I'm not necessarily sick. And this is where we're seeing this huge paradigm kind of happening within kind of our culture on health and chronic diseases. We've done a really good job over the decades of kind of combating acute infectious diseases. But what we're seeing now is this rise of chronic disease that's really kind of skyrocketing. And unfortunately, there's no pharmaceutical, there's no drug that is really being effective at kind of reducing these diabetes outbreaks or cardiovascular diseases. There's definitely a lot of medications that help to manage symptoms, but we've been approaching these chronic diseases here in Canada with pharmaceutical drugs, but those numbers continue to increase and increase. So a lot of it comes down to just kind of an unhealthy lifestyle. So for a naturopathic doctor, this is where I really love kind of this profession, because it really gives that foundation of health that protects a person from being unhealthy and then inadvertently becoming sick as a result of that. All right, so what is naturopathic medicine? What I like to say when people ask me what is a naturopathic doctor or what is naturopathic medicine, my short answer is usually medicine that's non-pharmaceutical based. That's the easiest way I can describe it without going into a long kind of tangent. If I have that time, then I'm gladly able to kind of sit down with them and explain a little bit more detail. But everything that kind of falls under that non-pharmaceutical umbrella can be considered naturopathic medicine. And really what naturopathic medicine is that you're looking at how can the body heal itself, and what can we do to kind of give the resources for that body to heal itself? So when we look at that body and its ability to heal itself, it knows what it wants to do. Genetically, in our DNA, it knows how to function within itself. If things happen to this site or that site or this site, X, Y, Z might happen to kind of protect the body. But over time, and if we're kind of we're lacking the resources to supply the body with its ability to recover, then that's where we start to look into kind of conditions of whether it be acute infectious diseases or chronic conditions or simple symptoms such as headaches and pain and insomnia or stress kind of affecting the work life. In terms of this list here, everyone's kind of experienced, or has everyone seen all these I guess, modalities, if you will? So at the bottom I put and more, because if I really wanted to put everything that kind of included under that naturopathic medicine, I'd have 10 slides and then probably more after that. All right, so I kind of spoke a little bit about that foundation, which I really love kind of being that integral part of putting this into an individual's life so that they can get that foundation of health. In Canada here, what we're seeing is a shift within patient-focused healthcare from disease-focused healthcare. So previously, we were focusing on the disease. How can we treat a disease? Whether it be treating it through going to a family doctor, medical doctor, naturopathic doctor, chiropractic doctor, going to see them to treat the disease. Whereas now, especially kind of going through the schools and the colleges here in Canada, there's kind of this push for integrative healthcare, which is really demanding a patient-focused approach where doctors all work together of different modalities or practices to treat the individual person. Because if a person has a cardiovascular disorder, they might need to take medications to balance that disorder, but then they also might need to see a pain specialist, whether a naturopathic doctor, a chiropractic doctor, an osteopathic doctor, to manage the side effects of kind of a health style lifestyle there. Or they might want to go to an exercise therapist to kind of improve their success rates of kind of reducing the disease itself. So naturopathic doctors, I might be biased as a naturopathic doctor, I really like to think that we are that foundation that puts the human together to give them what they need. So when I talk about that foundation of health, there's 4 things that I always talk about with patients. So the first thing is diet. So are you giving your body what you need to eat, the resources, the nutrients, the vitamins to sustain and to recover from anything that's happening? The other thing is lifestyle and physical activity. So are you active, or are you sedentary? Do you do a lot of movement? And movement will help to kind of heal the body, or benefit the immune system as we get that lymphatic flow. Stress management and sleep, those are 2 other big ones. So I would say stress management and not necessarily stress reduction, because stress is something that the body can use and can be a benefit. We don't necessarily want a situation where there's no stress, but we want to be able to manage that stress so it's not affecting us in negative consequences. And in sleep, are we rebuilding the body at the end of the day there? So those 4 things kind of make that foundation. And really, my job is to make sure that those 4 things are kind of included in any sort of treatment protocol, whether it be supplements, medication, or physical medicine. If those things aren't there, no matter what you're doing on the side, there's just not going to be a long-standing benefit. Your body won't not be able to recover to its fullest without kind of that foundation there. All right, so quick little information about myself. So as Lunilla said, I'm Dr. Guillemin here. I have a Bachelor of Science in Kinesiology with a minor in Psychology, which I did in Saskatoon. Is everyone familiar with kinesiology? I know some people haven't heard that word. So essentially what kinesiology is exercise and sports science, so kind of human movement and human activity. And so I finished that in Saskatoon, and then I did my doctorate of naturopathy at the Canadian College of Naturopathic Medicine in Toronto. So while I was there, I was actually the president of the student association. So I did a lot with the administration within the college. So if anyone has any questions regarding, I guess, becoming a naturopathic doctor, the schooling process, and kind of what it's like within the college itself, feel free to ask, but I'm not going to go into too much detail on that right now. And then, so I'm currently practicing at the Moose Jaw Naturopathic Clinic, which I believe is on 3rd Avenue. So I don't know Moose Jaw all that well. Like, I've been here for about 1.5 years in practice now. And I know the landmarks, but the street names kind of elude me. So. And then on the side, so I'm also a coach for the Kinsman Flying Fin Speed Swimming Club. So I train 6 nights a week, every weeknight, and then Saturday mornings I'm coaching kids there. And then within practice itself, so naturopathic doctors really do have such a huge, I guess, tank to use from for whatever they want to do. You'll never meet a naturopathic doctor who, well, you might meet a couple who are the same, but everyone has such an individual way of approaching their practice. And then there's a lot of different focus areas and specialties that people will see. So this is kind of where I will rank my focus and my specialties. So weight loss is a huge thing that I do in practice. And with kind of a background in kinesiology and psychology, I find that with weight loss or weight management, if we want to gain weight, that's something that can be applied to every different condition, whether it be dealing with headaches, whether it be dealing with hormones, especially dealing with hormones, or dealing with any sort of cardiovascular or chronic disease. Weight loss and weight management is a huge thing that will really boost the benefit of a long-term success. The other area that I really focus on is on cancer care, both adjunctively with oncologists. So I'll talk a little bit about some of the things I do in practice, but cancer is a big area of practice right now. And then chronic pain as well. So those I would say are the big 3. And then the luxury of being in Moose Jaw in kind of a rural area is you get to see a lot of different varieties. So yeah, I really appreciate that because I'm always learning more and I'm always kind of seeing new things. But I would say men's health, women's health, digestive health are the other big 3 that I quite often see in practice there. All right, so I'm just going to quickly talk about a couple of the therapies that I do in practice there. So the first one's intravenous therapies. So there's 2 main ones that I do in practice. The first one is high-dose vitamin C, and essentially what high-dose vitamin C is it's a protocol that we use for cancer care, whether before going through chemotherapy, on its own away from chemotherapy and radiation, or after conventional treatment of chemotherapy and radiation. And essentially, there's a lot of good research that is being done within vitamin C and how it works in the body, both intravenously and orally. What we see orally is that vitamin C, the molecule itself, it has an osmotic effect, meaning it draws water towards it. So we can only take so much orally before all that water goes into intestines and we get diarrhea or kind of this bowel intolerance. So we can only take a certain amount. When we put it in intravenously, that way we can get these high doses. So I'm sure everyone might have heard that. Yep.
Doesn't vitamin C turn into, I heard on, I was in Calgary, they're studying this, turns into like a hydrogen peroxide?
Yeah, absolutely. Yeah, so with vitamin C, when we take it orally, it quite often acts as an antioxidant. I'm sure we've kind of heard that vitamin C is a good antioxidant. What happens in cancer care and high-dose vitamin C is it actually starts to work as a pro-oxidant, meaning when it goes into the veins in kind of this high influx of vitamin C, it finds its way into the cells. Now, all cells have kind of enzymes that will break it apart, and what it breaks it into is hydrogen peroxide. So that hydrogen peroxide is then broken apart, and then it's taken to the liver where it's kind of cleared by these enzymes. Now, the problem with cancer cells is they no longer have this mechanism, this enzyme to break it down. So what will happen, like I was saying, it pulls water towards it. When vitamin C goes into that cell, it starts to swell, and eventually it'll pop itself. It can no longer sustain function within that vitamin C demand. So that's one of the kind of the current research areas that's really going on in naturopathic medicine and cancer research. In terms of the Myers cocktail is just another name for a vitamin and mineral mixture. So I use it for a number of different things in practice: pain, fatigue, deficiencies, immune strength. Something I didn't put up there, I have a lot of women coming in with kind of monthly menstrual cramps that is well managed with the Myers cocktail. And depending on what their symptoms are, I might put more of one mineral and more of another vitamin. In terms of the vitamins, and primarily the Myers cocktail, I usually have a discussion with my patients where I like to see a stepwise approach for treatment. And the benefit of the intravenous therapies is that we're kind of bypassing that absorption phase within our stomach and our intestines there. And when there's inflammation within the body through whatever sickness or illness there is, inflammation limits the amount of absorption of these vitamins and minerals. So putting it in, we get full absorption and then it goes right to the cells. Ideally, that's kind of more in cases where we're not absorbing the nutrients, where we're really deficient or depleted, or we need a quick boost or a quick fix there. So that's kind of what I say the first step of treatment should be. Ideally, what I'd like to see progress to is an area where we don't have to rely on the intravenous vitamins, but we can rely more on oral supplementation. So we can actually get the absorption rate without having to go through intravenously. And then the last step after that is, are we able to get all our nutrients and vitamins through our diet, through all the vegetables and fruits, vegetables, healthy fats and oils. Any questions about the intravenous therapies or? Yeah.
Were you saying you don't give intravenous vitamin C while a person is taking chemo? You give it before or after?
With vitamin C, and especially radiation therapy, vitamin C can increase radiotoxicity within the body. So there's a window that we want to avoid giving vitamin C during that. But you can definitely give it alongside it. I believe it's 8 hours away. So usually with the radiation, depending on what their radiation treatment is, they might be getting it every day or they might be getting it once a week. The once a week's a little bit easier to kind of co-manage with because then there's lots of time within the week. When it's once a day, it's a little bit harder to kind of schedule within that I guess viewpoint. But with vitamin C and the radiation, a lot of the current studies going on right now is radiation side effects that we see are kind of mitigated or reduced by vitamin C therapy. So I know the Ottawa Integrative Cancer Clinic right now is kind of the forefront of cancer research in naturopathic medicine. So a lot of their, grants and funding goes to vitamin C research. So right now that's kind of what they're looking at is what's the side effects profile of people taking vitamin C with their radiation or not taking it. It's outstandingly better with the people taking the vitamin C. Good question. All right, and then lastly, I just put this up here, acupuncture and cupping. I won't talk too much because we have a certified acupuncturist, which is great here. But this is something I use quite a bit for kind of pain and any sort of acute symptoms. I really like traditional Chinese medicine, which once again I won't speak too much on. But with acupuncture and traditional Chinese medicine, I love how there's a fusion between the Eastern approach to medicine and the Western approach to medicine. With an Eastern approach to medicine, this is something that's been going on for 3,000 years, and it's incredible that 3,000 years ago, when we had no MRIs, no X-rays, no way to really look at what's going on in the body other than a few external cues such as our pulse, our tongue quality, and then of course doing the autopsy after we pass. They've been able to kind of manage this pattern and the system of medicine. It's really incredible when there's really no, I guess, no gray areas. It's pretty accurate overall. And so with acupuncture, it's really incredible now that the research that's kind of coming out with acupuncture is really showcasing what they've known 3,000 years ago in terms of those specific acupuncture points. One of those studies that they found was that where these individual points are, there's an increase in kind of capillary density, meaning there's more blood vessels in those particular areas. So when we needle those areas, there's a higher demand of oxygen going to that tissue that will really benefit the body. But like I was saying, there's kind of a fusion between Eastern and Western medicine. So I do a fair bit of the Eastern approach, but a lot of what I do in practice with pain management comes from the Western side of things. So kind of injury, sports medicine, so kind of rehab, any sort of knee, back, shoulder injuries. That's what I do a lot for acupuncture here. Yep.
Would you be able to tell about beamer therapy?
Yeah, so I didn't include this on here, but essentially what a beamer therapy is. So that's something that we have in practice right now. I believe it stands for bioenergetic magnetic energy radiance. Don't quote me on that. We call it beamer for short, B-E-M-E-R. And essentially what it does is that it increases the electromagnetic waves. So essentially it's just a large mat that we put on a massage table, and we'll have a patient kind of lay on there for 10 to 20 minutes. And what we're finding within the human body itself, and this is kind of looking at more of a physics side of things, when we get down right to the atomic level of kind of our neutrons to protons to electrons, there's this push-pull of this positive charge, negative charge, and we get this electromagnetic, I guess, capsule to it. So then when we start to put those together, atom by atom, cell by cell, there's kind of this signature to within that capsule itself. And what we're finding with certain diseases is that energy frequency, or that capsule itself, is kind of off balance, so the cells are no longer able to function the way they want to. What's nice about this beamer is it kind of resets everything to where it should be, but also it increases kind of circulation through those mechanisms of resetting that. So it's a really good therapy to increase circulation to different areas. I'll use it once again for sports medicine, injuries, headaches, things like that.
And what is cupping?
So cupping is, I brought a couple of cups here as well. So there are these essentially, and it's something that's been used in traditional Chinese medicine for a while, but once again kind of fusing with Western medicine and kind of physical medicine. Essentially what it is, I like to refer to it as a reverse massage. So instead of pushing into the tissue, you're actually pulling up from the tissue. So I don't know if I can, well, essentially what you do is you have a suction pump here, and it kind of pulls the tissue up like that. So when we start to see injury, especially acute injury or subacute that's been kind of a week or so, there's a lot of scar tissue that's starting to form and fascia that's starting to overlie there. And that's where a lot of the pain comes, because there's less mobility, those nerves are no longer able to function. So this is really good to kind of help break up some of that fascia, bring in a lot of healthy oxygenated blood to that area, and remove any of the debris from the injury. It does cause a lot of bruising, so you do it, and then you see the big bruise on there.
People that have got it.
Yeah, if you see, yeah. And within sports medicine, a lot of athletes are starting to use it just for recovery. So after training events, they'll use the cupping just to make sure that there's no kind of that fascia or fibrous tissue forming over top after practice. All right, any questions about that, or? No? So I'm going to end there, because this is the last slide. So that's a good time to end. Yeah, and thank you for listening.
We'll have some more questions at the
Yeah.
end for everybody, so people might have some more questions. Thank you very much.
Thank you.